Is Jiajun, and this is my case or presentation of multi-state outbreak of Salmonella Stanley infections linked to raw cashew cheese. Step 1. Gather background information. The multi-state outbreak of Salmonella Stanley infections linked to the raw cashew cheese is a case from the Centers of Disease Control and Prevention, also known as the CDC. In 2013, Salmonella Stanley was an outbreak that had infected 17 individuals in different states. California, where 15 people were infected, one infected in Nevada, and another one in Wyoming, due to the consumption of raw cashew cheese that was manufactured by a company named The Culture Kitchen in Sacramento, California. Even though the raw cashew cheese was an outbreak, there were not many hospitalizations. No deaths were recorded. The products were recalled as soon as it became a public health issue, and there were no more cases after the recall on December 31st, 2013, as CDC urged customers to throw out any consumptions from the company. Salmonella Stanley symptoms include irritation, diarrhea, fevers, vomiting, and cramps. Step 2. Analyze the current situation. Strengths. The Centers of Disease Control and Prevention has an effective way to ensure the safety of the population. The mission statement is to be able to educate, inform, and help reduce an outbreak as soon as possible, such as identifying the source of the outbreak, which was the raw cheese items from Sacramento. Weakness. A weakness can be how the role of CDC is to control diseases and outbreaks, rather than solving them. For example, salmonella is a disease from unpasteurized consumption and the other causes such as food contamination, but all that the CDC did was to call off production. According to the CDC, salmonella lasts for around a week and individuals did not need to take antibiotics. Rather than stopping the production of products, they should be working with researchers to stop salmonella entirely, which helps with the model increasing health security and disease prevention. Opportunities. Opportunities from the CDC include informing the population about new concerns regarding health and the population through daily updates to educate the public about anything that may be concerning. Even though it is not concerning, daily updates will be able to educate the public about certain topics to look out for. Threats. Certain threats include the rise of new diseases and new variants of certain diseases. This would contradict with their ideas and actions because of how the new variants are able to adapt and bypass security measures that can harm the community and the population. Step 3. Prioritize core issues. The main source of salmonella outbreak was in 2013, which was the unpasteurized cheeses from the raw cheese dips, which was able to give individuals food poisoning and the salmonella strand. From the University of Minnesota Center of Infectious Disease Research and Policy, or the CIDRAP, the author Lisa Scherning talked about how there was a strain of salmonella that could have been only found in Asia, which was where the products were from. For example, in public health investigators such as the Nevada Division of Public and Behavioral Health, they were able to get the genetic code of the individual who had contracted the salmonella, which helped inform the population and research centers about the disease and outbreak. Step 4. Analyze alternatives. Theoretically, it would be safe to consume unpasteurized foods if they have trustworthy manufacturing, but it is advised to stay away from those products. In order to ensure the safety of the population, CDC recommends that it is best to avoid unpasteurized foods as it may contain harmful bacteria that may increase the risk of having salmonella or worse. By having pasteurized foods, this means that the harmful bacteria is eliminated and it is safe to consume. In addition, an individual should have checkups with their physicians and doctors to ensure that they are in the best health. Salmonella is able to spread through air, so it is best to keep perishable consumptions covered and refrigerated when not in use. Step 5. Provide recommendations. A recommendation is to only eat pasteurized foods and foods that are approved by the Food and Drug Administration or FDA by reading the label or the packaging. By looking at the labels provided in the packaging, the consumer is able to know the risk of having unpasteurized foods, which will help them decide whether or not it is safe to consume that product. Another recommendation is to wash and cook foods thoroughly to ensure safe consumption. This means that the individual should be able to have food is washed thoroughly and cooked within the temperature that is able to eliminate bacteria, so then it is safe to eat. This would also decrease the risk of food poisoning and salmonella as the items were handled with care and precaution. Step 6. Establish action plans. The best way to ensure the safety of the population is to have the FDA monitor and provide more strict modernizations when it comes to allowing unpasteurized foods to be consumed. For example, even though the FDA has been banned unpasteurized milk, cheese from that milk is allowed to be sold only if it has been left for 60 days. It is best if the cheese from the unpasteurized milk be closely monitored before putting them in grocery stores, since the raw cashew cheese event happened in 2013 and there are still salmonella outbreaks. By the time of 2026, most unpasteurized items will be deep checked for the safety of the public, which will lead to less outbreaks. If the public are eating unpasteurized foods due to the survival and poverty, there should be public health announcements through emails, posters, and public speakers by the CDC, and give information to give wash the foods and cook within a specific temperature range so that it is regularly safe to consume. If they cannot afford thermometers or water, there should be a fundraising event where people are able to donate money to help organizations hand out items that are able to decrease the risk of salmonella. Step 6 or 7. Finalize and in opinions. In conclusion, multi-state outbreak of Salmonella Stanley infections linked to raw cashew cheese talks about how there was a Salmonella outbreak due to contamination which helped 17 individuals gain Salmonella. Luckily, there were no deaths associated with this outbreak, and there are only 3 states affected. Salmonella is still present throughout the world, but it is more controlled. I believe that if unpasteurized foods are more monitored and deep checked before sending them into grocery stores, it is more likely that the unpasteurized item will be safe to consume for the general public. These are my references, and thank you for listening to my presentation.